So you said she has been running and now having pain an issue. Okay. What do you think are some of the big, like, I guess, metrics or key performance indicators that you would use as proxies to tell you, like, is she ready to handle the forces of running? What are you currently looking at?
So we don't have any, we're working on getting any like of the tech deck or anything like that. So I don't have any of those kind of things to look at with her. Um, but right now I'm most focused on her lack of strength and that, like I said, back to that motor control, because I mean her glutes are weak, hamstrings are okay, but like glutes and quads bilaterally. I'm looking at that strength. So we've been trying to work on a lot of, I've even brought it back down to like, let's just work on some bridges, like even doing supine stuff, take it back to like foundational level. So what I've been trying to look at with her, it's also been a challenge because she's not super adherent with her home exercise program, and I see her once a week. So for her, I've been looking at, like I said, that glute strength and that quad strength, and watching her. So I've been trying to do like step and stick, some bound stuff. And I'm kind of basing it off like verbal cueing with her. Like I've been able to not cue as much, but I'm kind of like lost with this with her at this moment. So I'm just really working on like, okay, let's do some single leg motor control, like TRX squats. Like I'm using the box, I'm using the mirror, I'm using verbal cues. So it's been tough for me with her.
Mhm.
But like I said, just that strength and motor control is really what I'm looking at right now. That's kind of what I have to work with.
Okay, gotcha. Well, that makes sense. So, like, a thought from this is like, when you can't coach, so this is really important with running stuff, because the more you complex you make the activity. So if we start getting to more like plyometric or pseudo plyometric or running interventions, and let's say I'm trying to coach somebody through it. So let's say I'm doing like a double leg or a double leg pogo jump, okay? And the person's like really stiff and they're hitting hard on that affected side. And I use a couple cues and it's not changing. And let's say I regress it a little bit and it's not changing. The question I need to ask is, it's one of two things. It's like, maybe I'm not using the right cue or the right input to get them to understand what I want. But you need to circle back around and say, do they actually have the capacity and the capability to do what I'm asking them to do? And oftentimes it's that, especially in situations where you have someone who has a complex case like this. So then you need to look and go a step deeper and say, okay, what do I want in this running movement or in this jumping movement? I need them to be able to decelerate and control, force, like, of their body weight magnified by gravity, right? At 15 to 20 degrees of knee flexion. That's what you're asking them when they do that type of drill. So get them in that position and see if they can even maintain that isometrically. Now put them in a position where they're doing like an anterior step down or just a retro step down and say, can they actually control that motion if now I'm taking away one of these components of force? And then start seeing that if you manage that and start peeling back layers. So what you need to start asking yourself is start looking at like number one, if I'm looking at this case and I see that, I say, all right, number one, does the person have the range of motion to access the position? So get them on the table, boom, boom. Okay, flexion extension's good, cool, that's clear. That's not the restriction. Okay. Two, do they have the, I guess, quote unquote, control to do it? So now I put them in a really regressed position where now I'm supporting body weight, ask them to get in that position and maintain it. So maybe I'm doing a split stance position where now I'm asking them to kind of get in that loaded position with asymmetrical stance support or hand support on something, where now maybe I'm doing like a little bit of a wall runner where I have them just kind of bending or flexing and extending in that position where now I'm pretty supported. I'm gravity assisted. Can they actually coordinate that motion well? Or is it something that even when it's really supported, they have it? Okay, cool. They have that next. if I start adding a little bit of load or a little bit of rate of force, can they manage that? And like what you're going to find is as you slowly start dialing that up, you're going to hit a restriction point. And that's what you know is your training point, and that's your restriction. So if you're training past that, it's a problem where you're asking them to do something they just don't have the capacity for. So coming back to that conversation with the patient and the parents, it's a show them, don't tell them. And it's starting to show them like, hey, if we're not able to manage this position, then it's not like a good idea for us to be putting you under the demands of running, because it's going to be like, yes, you can accommodate and adapt to it right now, but it might cause issues down the road. It's not going to be efficient. It might create bad habits that are not going to lead you to an efficient thing that in the end run. So it's something where you need to talk them through what those progressions are and the reason why. Because like I would use an example of like, this is like cooking a meal. If I'm baking cookies and I need salt and baking soda, if like I don't have the baking soda, those cookies are going to come out flat and you're not going to like the end product. So let's wait until we actually have that ingredient for us so we can put it all together. So that's what your process has to be, is looking at what are those, break down those constituent parts. So I think what's really important to understand here, and kind of like the drum I'm consistently beating on this with when it comes to return to run, is just because they are not meeting those qualities does not mean that you can't be doing things that look like running. Not only can you be doing them, but I think you absolutely should be doing them. So what you can do is to start looking at your, like I said, your track drill progressions, and start saying, all right, if I understand the forces imposed, understand what's going to be the biggest restriction, how far can I take them to where it kind of is within standard and looks good? So what you do is you start saying, okay, I'm going to start with a march. Okay. How do they look in just a general slow march? Okay. Now, sorry, I'll be right back. My wife just locked herself out of the apartment. Sorry. So if I'm looking at those constituent parts, right? So if I can take it from a slow march, okay? From a slow march, what's my next step? Now I'm going to go at a faster march where I'm actually putting more force on the ground, okay? If I turn that dial up, if I titrate that a little bit, what's that turn into? It gets a little elasticity, a little pop to it. Now I'm going with a gentle skip. So now I'm creating a small angle of faster flexing and extension, right? It's gonna be constituent parts that look like running, okay? I can now start increasing the magnitude and rates of that skip to where it's now more force on the ground. But the big important thing of all those is my foot's still striking underneath my center of mass for all that, okay? What we can do from there is we can turn that now from the skip into a low knee run. So I'll usually start with like, all right, this is like a tiny little run where now my foot is just going over my medial malleolus. Okay, the heel is clearing the malleolus. So these are called dribble drills, okay? But it's really just like a low knee run. So now I'm just kind of in place doing a little alternating boom, 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 boom. And then we can start moving with that. And then eventually that becomes foot over mid tibia, and then foot to knee. So now we're doing a high knee run. And this might be your progression in a warm-up. This might be progression over a week. This might be your progression over 3 months. It just depends on what the quality looks like. And what you'll find is they're going to get to a certain place where it's like, ooh, that doesn't look great. Okay, that's my stopping point. You can slowly start turning that dial. It doesn't have to be step 1, step 2, step 3. Always find ways to slowly turn the dial up. The way you do that is with the amount of excursion, the magnitude, the rate, and the position. If you need to regress it, a sled is a great way to do it because a sled now gives gravitational support. You can do it in place, holding a band, to actually unweight them to do it. That's your poor man's Alter G. All this stuff can be helpful, okay? And then we can start.
Yeah, I appreciate that. Sorry, continue.
Oh, no. And we can start looking at plyometric interventions too. So you can start looking at pogos. So now your pogos can start working on that little bit of bending and extending. We can start that with hand support on a sled, or we can use a band to start unweighting, to start giving them a little bit of elastic input. So now they start knowing what that feels like. Then we can take them off the band and start doing hops in place. And what you'll start noticing is as it gets better, is all those drills will start looking a little bit more springy. They'll start looking a little more fluid. Okay. And you can start increasing the amount of excursion they're doing. And what you actually might want to do during this time, especially for someone who might be like a little bit on the stiffer side, is you actually might want to slow their cadence down. So there's a concept of long coupled or short coupled plyometrics. Is that a familiar term to you guys? Okay, so long coupled would be my ground contact time is long and my excursion is large. Okay, so think about an oscillating wave that's kind of like this. Okay, can you picture that if I'm doing a pogo? So it's going to be, so I use a metronome for this all the time. So I set 60 beats per minute. It's going to be slow, boom, boom. So what I'm getting is now I'm actually constraining the activity to where now they have to get into a deeper knee flexion angle to push out of. Okay. Or we can use a short couple, which is going to be a stiffer, more elastic motion. The excursion short. So based off what the person needs, this concept of stiffness or compliance, we can choose which entry point we need to go with. Someone who is compliance deficient, so an example of typically an ACL, they're not going to like getting in those larger excursion angles. They're going to bias themselves and compensate using a stiffness strategy. So I might want to bias them towards a more long coupled compliant movements earlier. They're not going to like this as much. It's going to be harder, but it's going to make them kind of own it when they go to the short coupled stuff.
So I have a question about that. So like, for example, like I'm working with a few ACLs and I'm doing a lot of like high ground, like contact time and low ground. So pogos versus actually like absorbing the load. Is there one that you find with return to run? I know like running is more of that like elastic motion, but you need to see competence with both to get them to return to run, or is it something that's always like a work in progress with that?
So yes, I would say like, I don't think you need to be like to start running. And again, it depends on their style of run. And like, it's funny that like, so I'll kind of give a caveat here. The more I come around in clinical practice, like I started off with not a very good structure for return to run, meaning like I didn't really have a good system of like I said, it was kind of like, oh, 3 months. Okay. They're supposed to start running. Let's start running. I think it's going to be okay, to like, okay, they need to have boom, 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 boom. Doctor said you can run. Okay. You haven't checked this box. We're not running yet. Okay. To like more of a, okay, I rely on this criteria. I think it's useful because it's a proxy for me. But qualitatively, how does it look? Are they able to express movement in the way you want them to? Does it look good? And that's my allowance. How does it feel to them? So kind of my long-winded answer to that is like, if your criteria that you've set up for yourself is matching what you think the demands of running are going to be, which depending on the cadence of running that they're doing and how you're constraining the running drill. So if I'm going to do a kind of a slower cadence, like high knee run, or keeping them, they might not need to show crazy stiffness strategies, right? Or really, even if they're doing like if you're putting them back to like a slow jog, right? There's not a ton of stiffness needed like for that. It's kind of a slow, crawly run, right? So it just depends what you're doing versus like if I'm getting more into a sprinting motion, I need to see a more rapid ground contact time. So it just depends what you're looking for and what you're looking at and the way you're asking them to run. But ideally, you'd want to see them getting more competent at both of them. And probably to answer your question before going back to jogging, probably the answer is somewhere in the middle. I want them like, because it's going to be easier eventually if you're assisted to get the long coupled. The short coupled is going to be easy because they can use a stiffness strategy. What's that middle one look like? So maybe if I'm looking between 140 beats per minute and 80 beats per minute, what's that number in the middle that is going to kind of challenge both sides of the coin a little bit? And that might be more reflective of running.